plain and simple. What we're talking about, the CHPs, the UHCs, all of them sit in a healthcare system. So paint a picture for us, for the viewers who are watching tonight, what a healthcare system should look like for a country like Kenya.
Yes, so in terms of the healthcare system, we look at ideally 6 pillars that are well defined by World Health Organization. And this means that if you're building a structure, if one pillar is missing, then the whole structure really becomes very vulnerable to collapsing. So in the health system, we talk about the people. So that's the human resources for health, including the community health promoters who are being kitted the other day, and which is a very great step towards ensuring that health, which is defined in WHO, is not just the mere absence of disease, but everything holistically, including mental health. Then the second pillar we look at is the money, so the resources behind the system. So healthcare financing, when you talk about the kitting of these community health promoters, how are we going to sustain the kitting of them, or how are we going to sustain the referral system to the other health facilities? So that's, the money is really, really important. Then the third one, we're talking about the commodities. So this is what we use, whether it is in surgical, whether it is pharmaceuticals, basically the movable parts of the healthcare facility. And this is very, very important, because as these community health promoters are going to the homestays, they need to have basic things, as I think my colleagues have mentioned, things that they can use to attend to situations well before they escalate to the other level. So
just to be clear, when you talk about commodities, you're talking about thermometers, bandages, medicine. Is that what you mean?
That's what I mean. Yeah, vaccines in the higher facilities. So basically the items that you use to get people better. Right. And then we talk about governance, and I think governance is a very critical pillar. Huge. And here, when we see political goodwill, that's part of governance, where we have from the highest office in the land taking up primary healthcare approach in terms of fixing our health system. I think that's a very, very positive attitude, because we do hope that political goodwill will follow, resources follow political goodwill, number one. Number two, also accountability. Yeah, we can hold our president accountable and say, look, you said you're going to kit this 100,000, they've been kitted. How are we going to increase those numbers? Because 100,000 is a good start, but it's not enough. And then we also talk about health information systems. So this is the data or the linkages between how this young woman who's pregnant in the household, how are we able to monitor that this young woman, the health the pregnancy is really progressing well using the systems. And I think what I like about this current approach is that we've moved away. Victor, we used to have books, this ledger books this big, you know, and you can imagine, for records, yeah, both with the community health promoters and also at the health facility level. So digitizing this space is a game changer for us. And I think one of the things we really struggle is when you go to a facility, your health records are kept there. If you need to go to another one, you start all over again. So this is, the health information system is a very, very big game changer. So Victor, as I've mentioned, if those, and there are others who add research, because we have to learn from models that we've rolled out. For example, this model that we're rolling out, we need to have the baseline, we need to collect information during the execution, and maybe at the end of 1 year, we need to come back and say, did what we set out to do, what are we seeing? Do we need to adjust in one place or another? We get feedback from the community themselves, from the promoters themselves, from the facilities, from the public at large, because it's through that we keep on refining the model and keep on growing. So with that, you have a very holistic approach towards fixing or towards ensuring that your health system is running efficiently. Right.
Now, you've done an excellent job breaking this down and helping people understand what a healthcare system should look like. Yeah. Now, there's a word you and I know,